This is Bob Hyatt. I'm a professor at UCSF, and I'll be leading this session. We expect some other people to join, so I'm going to pause just a little bit before I start. Let's go ahead and start. We have the opportunity to share with you what we think is a very exciting new project, the Upstream Research Center. And the purpose of this call would be to explain the orientation of the center, what we're trying to do, and how we'd like you to help us do that through applying for pilot grants that we'll direct to advance the sort of goals of the center. So what we're going to do in this hour is first to have a couple just brief introductions. And then we're going to talk about the center itself, the Upstream Center, and its purpose and structure and directions. And then we're going to go through the overview of the RFA for the pilots, which I will explain in more detail. And then we'll finish up with what the requirements are in more detail administratively, and also the timeline. And in the end, we should have plenty of time for questions. And we really want to encourage you to ask questions because it's a complicated, new approach to research, and we expect there to be interest in this generally, but also in the details of what we're proposing to do with these pilots. I'll just say overall that we are very excited about this project because we are interested in the determinants of health, which are upstream, as we say colloquially. So we're not interested only in the biology of cancer or the behaviors involved, but what drives those behaviors and that biology. It's a new focus for cancer research. And in this NCI-funded project, this National Cancer Institute-funded project, we're given the chance to really explore how to study factors which are distant from the actual biology, but clearly influence it. So those are referred to these days as social determinants of cancer or social determinants of health. And the question is how you best study that. And so what we're going to talk about now is our efforts to do that in one overall, but in one piece, which is the pilot program. So just in terms of introductions, I am Bob Hyatt. I'm a professor of epidemiology and biostatistics at UCSF. I'm the associate director for the Cancer Center there for population science, and one of the PIs, co-PIs for this project. The other person speaking will be Dr. David Rakoff, who is a PI from Stanford. He's also a professor of epidemiology at Stanford University and one of my close colleagues. And then finally, Eileen Branaby, who will explain some of the administrative aspects of the project. And then we'll go into questions. And I'll be following questions from the chat. Eileen will be tracking those. But please get ready to ask questions. We want questions. We hope that we can be clear in our answers for you. So let me now turn this over to David.
Thank you, Bob. You captured that well, our excitement about this. And we're one of 5 centers that were funded by NCI nationally to work on these upstream issues. Part of all of the centers is a focus on communities that have been living in persistent poverty. And the NCI has defined this as residents in a census tract that have been under more than 20% of the residents living in poverty for 3 decennial census periods of time. So an important part of this center, in addition to focusing on upstream factors, is really focusing on those factors and how they're impacting cancer in persistent poverty communities. So to give you a sense of that, we do have a list available listing those communities for the state. But we have a particular focus in this center on a number of the persistent communities that are living in persistent poverty that are in the catchment areas of UC Davis, UCSF, and Stanford. So you can see this map on the left that's showing in red persistent poverty areas in the Bay Area. But on the right here, we want to zoom in because you can see that even though on the left, there's sort of, you don't see things that are around Stanford or in San Francisco, et cetera. When you zoom in, you can see that there's more of these areas locally around where our universities are. For our focus, we're in particular now over to the far right, thinking about some of the communities right around UC Davis, and particularly in West Sacramento, in San Jose area as well. But this is something we really want to see attention to this in the pilot projects, because it's a really core part of the center, thinking about persistent communities that are living in persistent poverty and the rates of cancer in those communities. Next slide. So again, thinking about where we're really focused, again, this isn't to say that all of these areas and these pathways and treatment and early diagnosis aren't really, really important. But this was really one of the clear things from NCI that they wanted this project and these centers to focus on that was really different than most of the other work being done at NCI, which is focusing on this prevention stage, pre-disease, pre-clinical. What are the things we can be doing at this point to, over the long term, prevent cancer in persistent poverty communities in particular? And so as you're thinking about projects or interests, there's multiple ways that we hope people will engage with these pilot projects. It might be that you've been working on sort of upstream factors in your work, in your research, but haven't applied them to cancer research before. It also may be, the focus of your work in the past was on treatment for cancer, survivorship studies, but you're interested in sort of expanding and building that work to think about prevention more specifically. And either of those could be great ways to kind of engage with the center, submit a pilot project, and, hopefully be able to expand your work in those areas. Next slide. So a little bit more about the two projects. So there's a lot in this center, like the pilot projects, training, bringing people together, but there's two main projects and a modeling core that are kind of central to the project. And so we're really wanting to engage pilot projects that are integrated in some ways and thinking about either tangentially or very specifically thinking about these type of processes. And so the first project is a guaranteed basic income project that's being done by the state of California. And so this is a large project that was funded by the Department of Social Services. And we're looking at how a guaranteed basic income intervention, a randomized community trial, impacts risk factors for colorectal cancer and to some extent cancer more generally. So this is about a basic income intervention. These are the communities that are going to be receiving funds from this, and that project is going to be evaluating it. So poverty, guaranteed basic income itself is a big theme and focus of the center and what Project 1 is about. Next slide. Project 2 also has to do with income and poverty itself, but that's focused on the California EATC. The EATC is a program that has a big federal program, but states can also have that program. And this Project 2 is looking at changes to the EATC that have happened in California over the last 8 years. One of those was that California increased the amount of credits for people who were very poor So, there's more details that we can send you about all of that. But this is sort of a new innovation for the state of California, and we're going to be testing how that relates to risk factors that are related to colorectal cancer. The other is that California expanded the EITC to be available to people who don't have a social security number, so people who have an ITIN number. So this expanded this to a much larger population of people in California. We're going to be looking at those effects as well. And so again, this is project kind of on this overall theme of the center, which is about income, actually reduction of poverty in households, and how that might change behaviors or exposures that are related to cancer. Next slide. And finally, we have a mathematical modeling core, which Bob and I are the PIs for that project. And this builds on work that we've done over the past decade or so to look at a wide range of risk factors, from biological to social to behavioral, and how they relate to breast cancer incidence specifically. And so we have a conceptual model that links this together. I'm not sure if there's a URL. I guess we should share the URL for this. But if you look up paradigm model and breast cancer and Hyatt and Rakoff, you'll be able to find it. But we have this conceptual model linking these things, and then behind it is actually a mathematical model. So with that mathematical model, we can explore different types of social or behavioral interventions, upstream interventions, and what the effects might be on cancer downstream in persistent poverty communities. So in this case, again, pilot projects that think about mathematical modeling, that think about social factors in mathematical modeling, income interventions, different type of interventions would be a really nice fit for the overall center. The other part of this that I think could really be synergistic or helpful with pilot projects is pilot projects that develop sort of coefficients for more social or contextual risk factors, whatever they might be. Because as we build this model, the validity and usefulness of the model is really dependent on having good coefficients from other types of studies for this factor. So doing studies that have coefficients that could help populate this model would be another way that pilot projects might be really a helpful, important part of our center. All right, I can turn it back over to Dr. Hyatt.
So what we're trying to accomplish with these pilot projects is several-fold. We want them to be the basis for expanding research support for other grants. So spin-offs from this larger grant that we would like to see working in this area. So we're trying to nucleate a whole new area of research, which is really important to us as investigators, but also to the National Cancer Institute. By the way, EITC stands for Earned Income Tax Credit. David works in this area so intensely that he didn't mention that. Maybe some of you didn't know what it stood for, EITC. Both of them are related to income inequality and income supplementation. But there are many other things that are also related to upstream factors in cancer that are called social determinants of cancer. These are things like housing insecurity, food insecurity, structural racism, transportation problems, lack of access to care, et cetera, et cetera. So you shouldn't be thinking only of income interventions when you're thinking of ideas about what you might feel are most important in the areas that you're interested in. But the field is wider than that. So the first thing is to expand research in this area. We'd like to get ideas from people who are interested, and we want evidence that would enhance the work that we do. And David just mentioned one way to make that happen would be evidence or factors which we can put into the model and test. And then the other thing is to facilitate new partnerships. This is a fairly unusual grant in that it brings together three major institutions in Northern California: UC Davis, UCSF, and Stanford. And the reason for doing that is because we can achieve synergy across not only investigators in these three institutions, but with the community partners that we have individually and jointly as well. And some of those community partners are on the call. So in deciding how to approach these pilots, we figured that there are three aspects that are really important. One of them is to involve community partners. And because this is something that affects communities, it's really almost required that we have community input into the projects, into their conception, into their implementation and interpretation. And I'll talk more about that in a minute. The second thing, which is important, is a lot of the effects that we understand are going to be introduced at a policy level or a pathway level. So we're not just trying to we're not trying to change individual behavior here, individual dietary behavior or exercise behavior or exposure to the sun, etc. We're trying to change population levers that make a difference for the whole population and the individuals within it. And sometimes these things are policy changes. So the two things that Dr. Rakoff just mentioned are policy measures that are related to income equality and rectifying differences in income. And so we're studying the impact of two policies that are already in place, but we anticipate that there would be other policies and programs that can be generated from our work that could be instituted by institutions, by local governments, or by the state, and make a difference over a longer period of time. And then the third thing, which is critical, is getting people interested in this type of work. We understand and support the idea that looking at higher level influences on cancer is a critical new area of interest for the National Cancer Institute. And the problem is we don't have a lot of investigators that are focused on that. And we want to provide some help to get people interested in it and trained in it and working and producing some data. So the third track involves support for fellows from the three institutions that can devote their time and projects to working in areas of persistent poverty. So here's a sort of a summary of these three areas. So community partners, pathways, and policy. And then on the right side, things that are general across them. So because we have the time, I think, I'll just go ahead and read this so that it's clear in your mind. But so community partners are going to support community prioritized research. Now, what does that mean? It means that we are looking for ideas coming from community partners that prioritize what they perceive as issues that generate or sustain persistent poverty in areas that they're familiar with. And these projects are meant to lead to interventions and capacity development that can rectify the problems generated by these social determinants. These are the ones I mentioned, like income inequalities, importantly for us, but also the other ones listed in the parentheses. I'll say more about community partner track in a minute. Then the second one is pathways and policies. Excuse me. So as I said, this supports projects that will examine how social policies aimed at reducing the impact of poverty can be can be generated. And we would like these projects to be used to support further policy changes. And it would probably be a good idea to engage with policy makers or people that have decision-making authority in doing these kind of projects. And then finally, the training and career development is pretty familiar to most people. It's a fellowship, but the difference is that we want people to be committed to advancing equity in these areas of persistent poverty and the particular challenges that they represent. We're interested in intervention studies. A small pilot is not going to be able to fund an intervention study, except a very small one, but it can produce early data to inform how a larger intervention study could be done. We're interested in projects that address rural communities, and the places that are in Northern California that are rural are frequently the areas of persistent poverty. And then we're interested in research projects aimed at understanding. This is the new challenge from my perspective, is asking the question, how do things at the social level, social determinants, affect cancer biology and cancer inequalities? And these might be looking at factors such as are listed there. So that's the overview. So another general comment is that the pilot studies need to be focused on persistent poverty areas in our catchment area of the three institutions. Now, catchment area is something that the institution defines. That is, for example, UCSF defines the area around it that they consider their responsibility, their service area, where their patients come from, where they have some programs going on. So each one of us has a catchment area that's well defined, and a map can be found of those areas. I'm not sure this is active, but in the RFA, it is. So you'll be able to see where the catchment areas are. And we've said that David said that we're working in these two areas, one up by Sacramento and one near San Jose, but that doesn't mean the pilot projects have to work in those areas. They could be any place within the catchment areas of the three institutions. And again, we're interested in pilots that could inform intervention studies, and we're interested in applications that look at the needs of rural communities. So let's go a little deeper. So each one of these tracks. So community partners. Oh, wait a minute. That looks like I skipped ahead one. Yeah. So community partners. So community prioritized interventions, research, and capacity development. That's the idea for this one. Now, the requirements for these are that it includes plans to increase the capacity of researchers and community partners in community engaged research. So this is really where the partnership becomes most critical, and that we are going to learn from our community partners and other community members about the issues and the problems with rectifying what we observe in persistent poverty. We need a brief letter of support from whichever community collaborator is involved or interested in doing this. And that has to describe the role of the community partner in the project, the compensation that's needed, and their plan to disseminate key fundings back to the community. So this doesn't live in an academic journal. This has to have some relevance to the community that we're working with. And then also pilots are expected to have some sort of deliverable at the end of the funding period, at the end of the year. And that could be a publication, could be a presentation or a poster, or some sort of report of preliminary results, something to show for the effort that went into it. So here's some ideas. These are just ideas. You could come up with others, of course, but one could be understanding in some way the relationship between biologic mechanisms, inflammation, genetic mutations, other other biologic pathways that lead to cancer, and their behavioral antecedents or social antecedents. Number two, maybe looking at climate change, which is a social determinant of cancer, actually, and what can be done to change the impact of climate change in an area. Maybe assessing the effect of structural racism, redlining, or other sort of institutional or structural ways in which racism has played out in our society and left us with persistent inequities. Another one would be how to effect co-design and evaluate programs and interventions aimed at reducing inequities in these persistent poverty areas. So this is sort of a pilot to develop an intervention or some sort of program that could be effective over the longer term. Develop and evaluate innovative community health worker models. So we know that promotoras and other community health workers are really critical in improving cancer health related topics, and how can those be developed and used to improve the status of individuals in those areas. And then you can see other exposures there as well as language issues. So just moving along in the interest of time. Track two is the pathways and policy issue. So this is really unusual, but we want people to be thinking about how policies can be studied to help with rectifying persistent poverty problems. So it's going to be good to engage relevant policymakers in the process, people that work, as I said before, at the local, regional, state level, and plan to promote cross-institutional collaborations. This would be between the three institutions, or the institutions we're talking about, and different disciplines within these institutions. So maybe epidemiologists and economists and anthropologists and political scientists, for example. And then pilots are expected to have a deliverable, as I said before. So types of projects in this path are developing methods to evaluate the natural experiments such as EITC and basic income, looking at the association between structural racism indicators and cancer behaviors, and working on models. Maybe some people out there are interested in modeling, and we would encourage them to join us with our own efforts to use a model to help understand the longer term and sustainable aspects of our interventions. And so another example would be looking at transportation. So this is a very sensitive thing that I'm trying to show you, and it keeps sensitive in terms of the slide changes. Track three is the early career one. Again, we want to train individuals who are interested in looking at upstream social determinants of cancer. And this can be in many different areas, but we want the pilot to help in the individual's career training program. And we also want to have that individual working across different centers for the purpose of enhancing our transdisciplinary approach to this. And then also we're expecting to have pilots that have some product, as in the other ones. Now, postdoctoral scholars with at least 1 year remaining of their fellowship are going to be eligible here. And they may serve as a co-PI or co-investigator, but they still need to have a faculty eligible PI on their application. Finally, for me, how are we going to evaluate these applications? Well, and you're going to hear about the details of the application in a minute, but we're going to look at quality, the relevance to the mission of the center. So it's not something going off on its in a different direction. The quality of the investigators, the training, the direction they're going. The community engagement is very important. We want to know that there are people from the community who are participating in these pilots. And then, generally the scope. How big is it feasible? Is it going to be something that can be done with a pilot project over a year? And then for the first one, with the communities, it's really going to be important that the ideas are responsive and relevant to the priorities that are expressed by the community. And that we hope that there's evidence of capacity building in the process. Now, we're going to now talk about the nuts and bolts of the application. And Eileen Barnaby is going to do that. So I'm going to turn it back over to you, Eileen. I hope that we get a chance to emphasize the importance of getting an IRB approval begun very early, because we realize that that could be a barrier to the efficient implementation of the pilots. So back to you, Eileen, or over to you, Eileen.
Thank you, Bob. Thank you for explaining the different tracks and the evaluation criteria. Now, what do you need to do to apply? So we'll start off with the research plan, and that would, of course, mean the specific aims have to be provided, that provide the pilot project specific aims, methods, and define and explain the persistent poverty census tract areas, need for a cancer control program, particularly of low income and underserved populations, and what research gap this would address. Intervention should include a description of how implementation will be evaluated. The other also needed here would be your research partnerships. You would describe the different partners that will be collaborating with you in this project. Cancer Center resource use is next. Of course, if applicable, you would need to provide a background statement on any relevant existing services or resources offered at the Cancer Center, and any staff expertise for the expansion of incorporation into a new program for this effort. We also have the work plan. Here you'll outline your work plan that provides a timeline for development and implementation of the research, which should include milestones for tracking the progress of the work. Awardees will be required to present their work in progress to the Upstream Regional Coalition Board twice during the 12-month project period. And we have also, as part of the research plan, of course, you'd mention your program leads. You'd include a statement of the qualifications for the identified leads of the program. Another requirement would be the statement of relevance to the overall aims of the Upstream Research Center, community engagement plan. And in this one, you would describe the process that lead staff members will use to identify the appropriate framework and to incorporate strategies to elicit input from and address cancer control needs of the clinics and the communities they serve in persistent poverty areas. The letters of support is, if it is applicable, and this would be for some applicants proposing to work with community partners or clinics, are required to submit letters of support. At least one letter of each partner or clinic will be fine. We also have other, the protection of human subjects document. This, of course, is if it's applicable for those who have human subjects in their research. Project investigators and their research staff must complete the CT training. And one of the things, as mentioned by Bob, is it's important that the IRB approvals would be required for funding dispersal, and generally not a valid rationale for no cost extension. So it is important that as part of this application requirement, IRB has to really be strongly encouraged applying and submitting this prior to your application. We also have other application requirements, such as the cover letter, NIH bias sketch, a modular budget, And more of those will be in detail explained in the RFA, which we have available on our website. Funding and timeline is the next most important thing that you have to know, is that the funding period is a year from May 1st, 2024 through April 30, 2025. And this is a 75,000 will be given as an award for direct costs. Direct costs include allowable expenses such as personnel, travel, materials, supplies, and other research expenses. All unexpended funds will be forfeited if not spent with the award period. There is no cost extension. We anticipate making 3 awards. At least one will support preparation for intervention study. Your application deadline is January 30 at 5 o'clock, and funding is subject to IRB approval. We again strongly suggest submitting an IRB application ahead of time. I know we keep on reiterating this, but it is really important that this is done. And last, I would like to say that applicants cannot have other current NIH training grants during the award period. So if you do have a pilot project which is related to the NIH training grant, you would need to check with your NIH program officer and their institution if this is allowed, and if there is no overlap with our Upstream grant funding period. So with that, it's back to you for question and answer.
Great. I'm sure there's a lot of detail that will come up as you go through this. So we're happy to answer any questions that have come to mind so far. So how do we do this? Do we have questions, Eileen, already someplace? Okay, here's Margaret Hitchcock. Oh, before you start, Margaret, I also want to introduce Elise Adams, who's on the call. She's my partner in the development project leadership. So she will also be available for answering questions and help with the process. But go ahead, Margaret.
One quick comment from a community partner is that's an incredibly short timeline for IRB approval, especially if part of your thing would be using a survey or something along those lines. I understand your need you won't be able to distribute funds without IRB approval, but that's just a comment from my perspective. Does it have to be, because I know so these are questions that are from the community partner application. Does the IRB approval have to be with whoever you're co-pairing with, that one, whichever institution you're pairing with, or can it be, say, the Western IRB?
I think it could be either one, but preferably with the institution itself. The reason why we're emphasizing that, Margaret, is because we've observed already that that it takes a long time to get IRB approval sometime. And so I think some anticipatory questioning of the IRB for the institution or wherever the approval is going to come from, what their meeting schedule is and so forth, and what their issues are, would be smart. That's all. We just don't want to have the projects waiting around doing nothing while they're waiting for IRB approval. So that's something you're familiar with, I think.
Well, and the reason I'm asking is because the Western IRB, and I think it might have been recently renamed, has a very short turnaround time. It has a cost of, I think it's $1,500 for a survey. But I think they guarantee it within a few weeks. So, if it was something where we as a community partner were going to be required to use UCSF or Stanford or UC Davis, I know that it's going to get bogged down. I was on UCD's IRB for 10 years. That's a slow process. But anyway, so that was my question for that one. Thank you.
Good. Thank you for that.
And just to add, Margaret, thank you so much for that question. We've addressed that before as well. You can't speak for the other IRBs. I do know that the Stanford IRB often prefers if the community partner is going to be involved in human subjects, but they do have an external IRB, and they have a list of ones they've worked with before, and they're usually very accommodating and have the community partner work with those external IRBs. So that could actually work well. I just can't speak for UCSF or UC Davis about how they can manage that process. But certainly that's an option.
Thank you.
Other questions? Michelle Napong.
Yeah, thank you so much for this presentation. This is very exciting to me, and I look forward to working on a proposal. I had a question about data, specifically if the Upstream Research Center has any data sets that will be available, especially kind of at population levels, regarding, for example, like cancer incidence or things like that, just knowing that sometimes accessing or formatting, can take quite a while.
Yeah, so I'll ask David to chime in on this too. But yes, we have, as part of our project, the director of the Greater Bay Area Cancer Registry, Dr. Scarlett Gomez, and the data from the registry is one of the major resources. But there's also other sorts of data, David, that you might want to let people know about.
Yeah, and no, thanks for that question. And yeah, in addition to the data that Bob mentioned, so at PHS at Stanford, there's a number of data sources that we have here, including a lot different types of electronic health record data, claims data as well. And so, as you're thinking about it, this goes for you and really for everybody on the call or listening, as you're thinking about projects and you think, well, this might be an ideal data set, or I don't even know what kind of data might be available for it. Send a question to us and we'll put you in touch with the right person to kind of really discuss it in detail to, find some data sources for you. And, the good thing is, there's some of these data sources can have a really long timeline for access, but because we already have them and have ongoing projects, we can really think about sort of a realistic timeline for our pilot projects. We can really be up and running on the data, even potentially have a little bit of, I know this is coming up very soon, but even a little bit of preliminary data or sort of counts on things to give yourself confidence that it could be a good data source for your project.
Great, thank you. That's really helpful.
Great. Good. Other questions? Now, don't disappoint me with no questions here.
Bob, I always have questions.
Yeah. Go for it, Margaret.
Everybody, I'm trying to be quiet because everybody else is being quiet. So David, I have a quick question. Do you know if those data sets would also include, so Alison Kurian has a recent paper that is linking genetic data for, I think it was breast, it was a variety of different cancers, and whether or not those data sets are also part of your data set that's available data? Because looking at high-risk patients is where I was going with this.
Yeah, it's something, we could definitely talk with Allison about it and talk about, what data might be available for a collaboration with her. Absolutely, that would be fantastic. So reach out and we can get in touch with her.
Yeah, I've had previous discussions. I wasn't sure if she was in any way looped into any of this.
I think that would fall probably under the shared resources as well, in terms of the Cancer Center. So the OncoShare data set, for example, that Allison works with is a part of that larger sort of infrastructure. And we want to facilitate that, right? We want people using the shared resources that have been developed as part of the Cancer Center. So that's a great idea.
Okay, thank you.
The other thing, Margaret, to think about, everybody actually, is the All of Us project, which is nationwide, but has a lot of data from the Bay Area as well, almost 10,000 people at this point. And that data set has behavioral as well as social determinants, as well as whole genome sequencing. So the program, the All of Us program, is encouraging people to use it. And you can go online and see what's there. So that's another data set that would be available.
I just, so for people that are on here though, there's restrictions. So by institution, there's restrictions. So I for C4 have access as an investigator, but if you're not with, I'm assuming Stanford and UCSF and Davis all have institutional access and they can get
Yeah,
additional access for somebody that may ask for it that may not already have access. But yes, I'm actually also on there as a patient, as a volunteer. So there
me
you
too.
go.
Me
Trying
too.
to do my civic duty. What can I say?
Right. Okay, so Margaret's given the rest of you a little chance to think about other questions.
I also have another question based off of the early career track. You had mentioned that postdocs should have 1 year left in
Yeah.
their postdoctoral appointment. So for example, like in a situation where you're like going to end your postdoc and transitioning to faculty, then only track 1 and 2 would be available to you or something?
Yeah, because the fellowship, it lasts a year. So if you're already finished with your postdoc, it just doesn't fit. So that would be the way to look at it. Is you may be close to becoming a faculty member. Of course, it'd like to be some proof of that in your application. But that's the way to do it. Track 1 or track 2.
Okay, thank you.
If you're too unsure about asking a question or some other reason is holding you back, you can contact the center at this URL, the upstreamresearchcenter.org, and we can direct you to the person who can answer your question the best. Again, we're excited about this project. We're excited about your interest in it. And we want to help you be successful. So we're available for answering questions. Anybody have any other questions? I guess we were pretty clear then, which makes me feel good. So I hope this was clear, and that again, if you have other inquiries, please follow up with us. We're excited about moving ahead with this. Okay, bye-bye. Thank you.
Bye.